Welcome to the Ovation Healthcare Learning Institute podcast, your source for informative and inspiring conversations around the world of healthcare. Hear from the individuals and organizations making a positive impact on the industry and bettering the health and economic wellness of their communities. In each episode, we bring together thought leaders, healthcare professionals, and industry experts to discuss the latest trends, technologies, and best practices. Whether you're a provider, a patient, or simply interested in the ever-evolving world of healthcare, this podcast offers valuable insights across the entire care continuum. Subscribe today and be a part of the Ovation Healthcare journey.
Well, hey everyone, we're thrilled you're here to join us as we talk about the dynamic landscape of healthcare. I'm today's host, Gina Lehman, Senior Consultant of Clinical Services for Ovation Healthcare. In today's episode, we'll be speaking with Ovation's Chief Clinical Officer, Dr. Kristine Keefer-Wolff. Dr. Wolff is a healthcare executive with more than 25 years of system and business unit level healthcare experience, with a history of creating and improving workplace culture, employee engagement, and patient outcomes. She's known as a transformational leader skilled at relationship building with internal and external partners. She's also experienced in labor relations and building shared governance models. Thanks for joining me today, Chris. I'm excited to be here with you today to talk about improving patient safety through Leapfrog Safety Grades.
Thanks for having me, Gina. I'd love to share a little bit about you too. Gina brings over 25 years of experience in clinical, leadership, and advisory roles in healthcare and possesses a strong background in strategic organizational development, program and process improvement, patient experience consulting, and operational oversight. Gina is passionate about the integration of quality, safety, and experience elements in patient care delivery and has served as a trusted partner with various organizations to positively impact performance and achieve sustainable results.
Well, thank you for those kind words, Chris. And with that, let's dive right in. I know some of our listeners may know what a Leapfrog Hospital Safety Grade is all about, but just in case some are unfamiliar or need a little refresher, can you give us a little bit about the Leapfrog Hospital Safety Grade, Chris? Its goal, why it's important?
Sure can, Gina. Thanks. So the Leapfrog Hospital Safety Grade is the only hospital rating focused exclusively on hospital safety. It is assigned to nearly 3,000 general acute care hospitals across the nation twice per year in the spring and in the fall. And it's represented by letters from A to F. The safety grade offers a clear snapshot of hospital safety performance, allowing consumers to choose the safest hospital to seek care. Leapfrog's aim is to motivate hospitals to continually improve the quality of care and aim for the esteemed A grade as they enhance their patient safety culture.
Perfect. And I'm glad you mentioned consumers because that leads me to my next question. Why do you think healthcare professionals and hospitals should pay close attention to these grades?
Excellent question, Gina, and one that's important our listeners know about. Since Leapfrog Safety Grade is publicly reported and comparison can easily be viewed by patients, employees, and providers alike, a higher Leapfrog Safety Grade is crucial for enhancing the hospital's reputation as well as patient safety practices. Potential patients may be trying to decide which hospital to attend and when searching for information, come across the Leapfrog score. Most patients gravitate towards hospitals with higher safety scores for their own peace of mind. The same goes for recruiting providers and even clinicians to your organization. If your hospital isn't performing well on these grades, it can be a challenge to convince clinicians to join your team. People want to work where quality and safety are taken seriously.
Great points, Chris. And I think it's vital to have a strong foundation in our understanding of what hospital Leapfrog safety grades are and why they're important before we move on. And now that we understand that a little more, can you share where you think that leadership teams should start when trying to improve their grade?
Sure. Thanks, Gina. Actually, this isn't just about improving your hospital grade, but rather about improving your hospital culture of safety. And the scores will follow. Patient safety has to be ingrained into the everyday operations of the organization, and that starts at the top. Hospital leadership plays a pivotal role in driving patient safety initiatives. Leaders must not only support, but actively participate in fostering a safety first mindset by way of a few things. First, making patient safety a top priority at the board and executive levels. Second, establishing clear accountability structures where leaders, managers, and frontline staff are all responsible for safety outcomes. And third, maintaining transparency in reporting errors and near misses, and ensuring that all levels of staff contribute to solutions and celebrate the successes.
So well said, and I completely agree. Hospitals that aim to improve their Leapfrog safety grades and other quality measures really must take a proactive and strategic organization-wide approach to patient safety. So by fostering a strong safety culture and requiring leadership accountability, hospitals can make meaningful strides in preventing harm and delivering better patient outcomes. So that having been said, could you talk a little bit about how an organization can foster that culture of safety within their own walls and what this looks like in practice?
Great question. And as you mentioned, this is an essential focus for hospital leadership. A robust culture of safety ensures that staff feel empowered to speak up, report concerns, and contribute to improvement efforts without fear of reprisal. This requires hospitals to do a few things. Conduct a culture of safety survey regularly, sharing results, and implementing action plans based on the feedback. Embed patient safety into core values and strategic plans to reinforce its importance across all levels of the organization. And encourage open dialogue where staff can identify and address risks proactively. In general, a culture that prioritizes learning and continuous improvement leads to fewer preventable errors and higher safety scores. And really, isn't that what we are all striving towards?
Great points, Chris. Thank you. So, given your experience in working with many of our client organizations, can you share with us some other examples of strategies a hospital could look into when aiming to increase their grade?
Engaging patients and families as active participants in their healthcare journey strengthens the hospital's ability to provide safe, high quality of care. So it really starts there. An effective strategy for patient and family engagement should include 1. Developing an integrated approach where patient voices are incorporated into safety and quality initiatives. 2. Using patient feedback to identify areas for improvement and drive meaningful changes. 3. Establishing family engagement councils to ensure patients and caregivers have a seat at the table in decision-making processes. Another strategy is engaging a partner like Ovation Healthcare, who understands the importance of patient safety, has experts in the space of quality improvement, and helps hospitals take the necessary steps to achieve a notable safety grade. Our own Leapfrog Certified Coaches can help hospitals in a variety of ways, such as providing education for everyone, from clinicians to administrative staff, to ensure everyone understands the importance of patient safety and how to implement best practices. Individual coaching for hospital staff, where we identify and provide input on how to improve their performance. Reviewing hospital data to identify trends and areas where hospitals can make improvements. And by providing proven resources, strategies, and interventions that hospitals can implement to enhance patient safety and quality.
Well, thanks, Chris. Right there, you've touched on one of the things I really love about working with various hospitals. Each one is different, and Ovation allows us to really tailor our approach to meet each hospital's unique needs while drawing upon known best practices and standards of care. That having been said, can you share with me an example of how a hospital we worked with successfully utilized our clinical services to improve?
Absolutely. We recently helped a 99-bed hospital in the Midwest better understand and utilize the tools provided by Leapfrog to bring their Leapfrog safety grade up from an F rating to a C rating in 1 year. While there are still some long-term improvements to be seen, the 2-grade improvement is a tremendous accomplishment, and we were proud to provide expert guidance and closely partner with them on their journey of improvement.
Well, that's an incredible result. Truly fantastic. And please, congratulations to the team. That's fantastic. So, Chris, I'd like to thank you for your time and expertise today. And as we begin to wrap up this episode, do you have any closing thoughts that you'd like to share?
Yes, please let us know how we can help. We certainly have expertise available to you, including several Leapfrog certified coaches right here at Ovation Healthcare. We are always happy to work hand in hand with client organizations to help them be successful in their Leapfrog safety grade improvement journey.
All right. Well, that brings us to the end of this episode. And thank you so much for your time, Chris. And thank you to our listeners as well. We hope you enjoyed this talk on how Ovation helps hospitals improve patient safety through Leapfrog Hospital Safety Grades. Don't forget to follow us on LinkedIn at Ovation Healthcare. And if you found this episode to be interesting and would like to learn more, please visit us at ovationhc.com. Have a great day, everyone.